Hi everyone, my name is Emily Hersch, and today I will be talking about the development of Helpers, a free digital parenting program that will teach parents of children aged 10 to 13 years evidence-based emotion regulation strategies to promote mental wellness and effective parenting skills. First, I will talk about the theory and rationale behind the Helpers program. Second, I will talk about the development of the program using user-centered design methods. Third, I will present results from two studies we conducted, which included a needs assessment survey and a series of co-design workshops to help us better understand parent needs and preferences for digital tools focusing on emotion regulation and stress management skills. Fourth, I will end by discussing some future directions for the Helpers program and implications for the development of low-cost, accessible, and user-informed online resources for parents. Helpers stands for Harnessing E-Learning for Parental Emotion Regulation Skills, which is an online parenting program that we are developing to teach parents emotion regulation skills to promote parent affect regulation, behavioral activation, and positive parent-child interactions. Now I'm going to briefly discuss the theory behind the Helpers study. The Helpers program is based on dialectical behavioral therapy skills training. As the slide shows, DBT-ST emphasizes distress tolerance, mindfulness, emotion regulation, and interpersonal relationship skills. Previous studies have used DBT-ST as a transdiagnostic treatment for emotion dysregulation. Dr. Heather Risser, the principal investigator of the Helpers study, previously adapted and implemented a web-based self-directed emotion regulation curriculum based on DBT-ST with parents of children with special healthcare needs. The curriculum, however, was not interactive, participants were not involved in the design of the program, and program outcomes were not assessed. Thus, the current project aims to fill these gaps by employing a user-centered design method to make the curriculum more interactive and to tailor the program to a general parent population. Helpers targets emotion regulation skills because the majority of mental health diagnoses involve some aspect of emotion dysregulation. Specifically, in a family context, parents with greater awareness of their own emotions engage in more parenting behaviors that are associated with adaptive child outcomes compared to parents who are less aware of their own emotions. When parents cannot effectively manage their own emotional responses, for example, under conditions of high stress, their parenting practice and ability to socialize their children's emotional learning can be compromised. And this is particularly relevant during COVID-19, as parents are reporting heightened stress compared to non-parents. Thus, to improve children's emotion regulation capability, it is necessary to develop accessible, parent-focused interventions to enhance parents' emotion regulation. We hope to teach a wide range of emotion regulation skills to a general parent population. By taking a strength-based approach, the Helpers program could reduce stigma and encourage more families to engage in evidence-based services in the future. For our current phase, the Helpers program will be designed for parents of 10 to 13-year-olds. This age is considered a high-risk developmental period for the onset of mental health disorders. As the WHO reports, half of all mental health conditions start by 14 years of age, but most cases are undetected and untreated. It's also important to consider why we would want to develop an online program for parents. There are many potential barriers that exist when accessing traditional face-to-face services, including cost, geographic barriers, lack of providers, long waitlists, and stigma. These barriers can make it especially challenging for minority and low-income families to access and engage with traditional services. Published costs for many widely disseminated parenting programs range from $500 to $1,700. Session lengths are typically 1 to 2 hours per week, with sessions usually taking place over 1 to 5 months, which makes these services hard to reach for many families. Additionally, parenting programs are also often conducted in large group settings, which reduce the flexibility of the program content and reduce opportunities for personalization. Online programs have the potential to offset these challenges, making mental health resources more accessible to parents. Online resources can also be accessed for free and at times that are most convenient for parents, allowing them to use these resources in a way that best fits their needs. In developing helpers, we wanted to ensure that the program was going to be useful and acceptable to parents and fit seamlessly into their daily lives. So we incorporated user-centered design methods into our studies to better understand parents' service needs. Next, I'll be talking about user-centered design, which I'm sure a lot of you are familiar with. When designing digital interventions, it's critical to include users in the design process. Needs assessments, including surveys, focus groups, and interviews, are often conducted as standard practice when developing online interventions, in order to assess user needs and preferences to ensure an effective and acceptable end product. The design process is iterative, which means that designs often go through multiple iterations, so it's recommended to start with a low-fidelity prototype. A low-fidelity prototype can be a rough sketch or a first step in building a digital program. As you receive feedback from potential end users, you adapt the product to better fit their needs. Here is a timeline for our development process of the Helpers program. First, we conducted a needs assessment survey to better understand parents' interest in emotion regulation-focused parenting programs and parents' willingness to use digital mental health tools for emotion regulation and stress management. Using this data, we created initial sketches of the Helpers program. We then showed these designs to parents during co-design workshops, which are group workshops where participants provide feedback on program content and create designs of their own. Based on the feedback we received from parents during these workshops, we will develop a high-fidelity prototype of the Helpers program. In November of 2020, we recruited 35 parents of children aged 10 to 13 to complete a mixed methods needs assessment questionnaire. We collected data on parents' emotion regulation capabilities and interest in participating in online parenting programs focused on emotion regulation. I will now discuss some of our main findings from the needs assessment questionnaire. We examined what stressors parents were experiencing due to the impact of COVID-19 and found that working parents with school-age children endure additional challenges as they face stressors related to both their children and themselves. This finding helps us understand the impact of COVID-19 on parent stress and to tailor future parenting services and resources, such as the Helpers, to best address parents' concerns and meet their service needs. We also assessed if parents had a need for and interest in an emotion regulation skill-based parenting program. We found that the majority of parents experienced difficulties managing their stress or emotions in their role as a caregiver, were interested in learning and practicing emotion regulation skills, and believed that learning emotion regulation skills would make parenting easier. We also examined parents' willingness to utilize online programs and preferences for digital mental health tools for stress management and emotion regulation. We found that parents are interested in online programs, prefer to use an interactive website compared to other virtual platforms, and report wanting to use a digital tool at least once a week for 30 minutes or less. In summary, this study provides evidence for parents' interest in engaging in digital mental health tools to learn emotion regulation skills and provides us with important information about how parents want to use digital tools. We saw that parents wanted to use a digital program in short bursts of 30 minutes or less, which directly contrasts with the way in which traditional parenting programs are typically designed. Our findings also emphasize the importance of integrating users into our research process. By identifying parents' needs and preferences, researchers are better able to implement acceptable, scalable, and sustainable digital programs that can yield positive mental health outcomes for families. So we used the findings from the needs assessment questionnaire to inform our development of preliminary Helpers content, which included interactive exercises such as games and activities, through which parents could learn and practice emotion regulation skills. We then conducted 3 90-minute virtual co-design workshops with a total of 15 parents over Zoom. Each workshop was split into 2 parts. In the first part, parents took on the role as designers for the program. They were asked to brainstorm program features, sketch how these features would be organized on a homepage, and create a comic depicting a parent using the Helpers program. The second part of the workshop included presenting initial design ideas and preliminary Helpers program content to parents and asking for their feedback. After the workshop, we invited all participants to complete a feedback survey on their experience participating in the workshop and their interest in using the Helpers program. 14 participants provided their demographic information. We had an even split of male and female participants, and we had a predominantly Black African American sample. The majority of participants had a household income of over $75,000, and most participants had an education level of bachelor's degree or higher. So parents were asked to brainstorm program features they would want to see in an online program that focused on emotion regulation skills and stress management. Parents reported wanting a wellness hub to support their and their child's physical, social, and emotional health. Parents wanted to engage with their child through the program and were interested in learning practical tips for how to manage stress, communicate effectively with their child, and understand child behavior. Parents also wanted access to self-guided relaxation tools. Parents were then asked to sketch how they would organize their list of features on the homepage of a website. Parents' designs emphasized that the website should be easy to navigate with clear menu options that have big fonts and big buttons. The website should also include a wide range of activities and different types of support for parents and their children, such as engaging activities for children, meditation videos, and motivational quotes. Many parents also included stress management and relaxation tools on their homepage. As you can see on the left, some parents included features such as talking to a professional and connecting with other parents. Other participants emphasized practical tips and advice from experts on a variety of topics related to child development and parent-child relationships. For our last design activity, we asked parents to draw a comic and respond to questions such as, why would a parent use a parenting program such as Helpers? In these comics, parents indicate they would use the program when they are feeling stressed and in need of support. On the left-hand side, this parent depicts an easy-to-use search bar for problems such as sibling rivalry and impulse control. Helpers would support this parent by encouraging them to take a break and by providing a script for how the parent could approach a given problem. On the right-hand side, this parent describes using Helpers to relieve stress and help their mental health and life as a parent. They emphasize that Helpers would be an accessible tool that could be used anytime and anywhere. This parent would use the tool to learn about other parents' perspectives and receive guidance in their parenting role. These comics depict parents who are feeling sad, inadequate, or stressed, talking about what they are dealing with a friend, who recommends that they try the Helpers program. On the right, this parent highlights that the Helpers program can provide parenting tips and ways for parents and children to bond that will help them feel happier together. Similarly, on the left, the comic shows that after this parent uses the Helpers program, he becomes the best dad ever. Next, we presented some preliminary program content to the participants and asked for their feedback through poll and discussion questions. For example, we showed participants different formats of the program content, such as podcasts, comics, text-based, and interactive web pages. We were really excited about the comic we made and thought parents would also love it. And only one parent said that they were interested in seeing cartoons in the program in our poll question. So this sparked a discussion about our art style, as some parents said that the cartoon-like features made the program seem childish. We also showed parents examples of possible interactive content, such as games and activities. We were surprised to see that parents liked the mix and match activity and the interactive game so much. Through the poll questions, we also learned that parents are very interested in a social component that would allow for parents to communicate with each other and would be interested in hearing from other parents that have used the program. Incorporating user-centered design into our study gave us valuable insight into parents' needs and preferences for online programs. The majority of parents expressed interest in a program that met a broad range of needs, including support for physical health, emotional well-being, and stress management. Parents were interested in resources and activities that would promote well-being and teach parenting skills, which provides initial support for the development of the Helpers program. We will now take what we learned from the Needs Assessment Questionnaire and the co-design workshops and apply this knowledge to the next iteration of the Helpers program. Once the program is developed, we will test the usability and acceptability of the tool with a new set of users and ultimately test its efficacy. We will prioritize recruiting a diverse sample in the next phases of the study in order to ensure that the program meets the needs of families from diverse racial and socioeconomic backgrounds. The Helpers program will be designed as a population-level tool to promote mental health and well-being, which can be used as a standalone program or as a foundation of a stepped care model. By adopting an inclusive user-centered design process and extending resources free of charge, the Helpers program has the potential to diminish health resource disparities and increase the accessibility and affordability of evidence-based resources for families that are acceptable, engaging, and effective. We encourage you to visit our website, which includes more information about our studies. And once we develop the program, we plan to host the program for free on this website. I would also like to thank our amazing Helpers team. Dr. Heather Risser, the PI on the Helpers study, Dr. Emily Laddie, the co-PI for the project, and Yolanda Yang, a co-student investigator on the study. Thank you so much, and please don't hesitate to email us with any questions or comments. We'd love to hear from you. Thank you.